Currently, CO monitors are not being used due to COVID, and this is a vital tool to initiate the conversation around smoking. As a reminder outlined in Saving Babies' Lives, women should be referred if their CO reading is over 4 parts per million. A reading over 4 indicates exposure to carbon monoxide in the last 24 to 48 hours. When trying to identify pregnant women exposed to CO, it is better to use a low cut-off point to avoid missing someone who may be at risk. We have seen a drop in referrals, so it is more important than ever to refer smokers, women who have recently quit, pregnant women vaping, and partners of people who smoke in the household with their consent. At each antenatal appointment, it is essential that the brief advice is given about the risks of smoking in pregnancy. The pregnant woman can be referred at any point in their pregnancy. NRT is safe in pregnancy, and vaping is 95% safer than smoking. It is important to document if the woman has declined the smoking intervention and that the risks have been explained to her. Smoking at time of delivery is the only way of knowing the outcomes of the stop smoking intervention provided by both the midwives and Healthy Cornwall Stop Smoking Service. Question 1. True or false? If a woman stops smoking before 15 weeks of pregnancy, the risk of premature birth and low birth weight will be the same as someone who has never smoked. True. Evidence suggests that if women quit smoking completely by the 15th week of pregnancy, the risk of the baby being born early or being a low birth weight is the same as that of a non-smoker. But remember, it's never too late to quit, and women should be encouraged to quit at any stage of pregnancy. This is useful in your brief intervention discussion. How much of smoke is clear and odourless? 85%. True or false? The government target is to reduce smoking at the time of delivery to 11% by 2021-22. This is actually false. The government target is actually to reduce smoking at the time of delivery to 6% by 21-22. True or false? Smoking is the leading modifiable risk factor for poor pregnancy outcomes. This is true. Smoking during pregnancy causes up to 2,200 premature births, 5,000 miscarriages, and 300 perinatal deaths every year in the UK. It is also associated with premature birth, low birth weight, ear, nose and throat problems, respiratory conditions, diabetes and obesity. True or false? CO testing should be offered to all pregnant women at every antenatal appointment. This is true. As outlined in Saving Babies' Lives and NICE guidance, CO2 testing should be offered to all pregnant women at every antenatal appointment throughout their pregnancy, including booking in 36 weeks. CO screening is not only about establishing smoking status, but ensuring pregnant women and their families are safe from poisonous gas. True or false? Cutting down the number of cigarettes smoked each day reduces the risk to baby. This is false. There is no safe amount to smoke during pregnancy. Cutting down does not reduce the risk to the baby, as women compensate for fewer cigarettes by taking more and deeper puffs, therefore exposing the baby to the same level of toxins. Smokers who set a quit date and stop abruptly, rather than cutting down gradually, are more successful. Which vitamin is recommended in pregnancy? Vitamin D. It helps with calcium absorption and prevents rickets. Vitamin D is generated by the sun, so it is advised that we take a tablet form, as in this country we do not get enough from the sun alone. How long would it take to burn off 2 chocolate digestives, 166 calories worth? For that little snack you'd have to walk for 42 minutes or swim for 18 to burn off that many calories. So final question, when can you add 200 calories in pregnancy? If the BMI is within the healthy range, you can have an extra 200 calories in the 3rd trimester. But remember, activity levels often significantly decrease towards the end of pregnancy, and if this is the case, those calories may not even be needed.